Now what excites me is this material. This is called Sofreliner. It comes from a company called Tokuyama. They are in fact sponsoring this presentation tonight. And you should understand that this is not like the other lining materials that I just talked about. This is a little bit different. This is in fact a silicone material. This is not an acrylic. Acrylics bond to acrylics. So if I put AutoCure methyl methacrylate onto a denture, it's going to stick. You put silicone onto a denture, it's not going to stick. So you need a bonding agent that connects the two pieces to each other. And then you need a reline material that has a certain softness to it. And this is nice. They've got a softer version and they've got a harder version of this particular material. But let me tell you that the harder version is in fact quite soft. Now these materials are very easy to work with. They have really good lasting properties, so the durability is anywhere from 6 months to 24 months. I've had them in the mouth for 18 months. They seem to hold up well. At that point, really, it's time to change them, but they do really work well. They do have high tear strength. They don't really change color very much, and using the adhesive of this system, the stuff really does stick, and that was always a problem earlier on. Now, there isn't a lot of actual porosity in these materials, so you don't get a lot of contamination and odor from them. It's easy to use, and I'll show you exactly how this material is used. Now, I said there were two materials that are available here. These arrows that you see on the screen, in the soft region, you've got your Viscogel. I talked about CoSoft, and in fact, the Sofreliner Tough, the soft version, is at a shore hardness of 24. That's pretty soft. Okay? If you've tried any of these other materials, you'll know that that in fact is pretty soft. Polyether impression material is roughly in the 60 range. Polyvinyl is in the 50 to 55 range. And even those materials have a certain softness to them. The Sofreliner Tough M is up at 43. And this is checked. This is actually checked using Shore A hardness. Fairly simple test to use. These materials are soft. That's what you have to remember. So patients with sensitive ridges, patients with allergies to acrylic against their tissue. I had a phone call the other day from a dentist who had a patient who, once he relined the actual denture, patients said that the denture just burned their mouth. And I said, well, did it burn their palate or did it burn their lips? And the patient said, no, just the palate. The reline was redone in this material, which again is not an acrylic. There's no monomer here, and that burning goes away. So for allergy situations, for monomer situations, this is a really good product.